I'm here with Dr. Atencio at Texas Spine Sports Therapy Center in Austin, Texas. Can you tell us a little more about yourself and your practice?
Sure. Thanks for taking some time to learn about our clinic. I've been practicing for 15 years, and we've been actively involved in treating chronic and difficult to treat spinal conditions such as disc herniations, disc degeneration, sciatic pain, nerve type pain in the arms and hands, sports injuries, any orthopedic type of complaint. We've combined the best in physical medicine with technology to treat these conditions quickly, painlessly, and help people avoid surgery. Some of the procedures we've been using for chronic spinal pain consist around decompression therapies, high-tech rehabilitation, laser-like therapies using this class 4 30-watt laser to really stimulate this disc and give it a chance to heal well without surgical removal.
Are there any risks involved, or is it painful?
You know, the good part about doing physical medicine is that the risks are very minor. Soreness can be there, but we're very, very careful, and we've done so many of these at this point that we know how to do it. So risks are minimal. It's generally painless, and most of the procedures actually feel pretty good. The laser, you know, people should not be nervous about these lasers. These lasers feel good. They really help with pain, and the healing and the ability of the body to help itself with these lasers is significantly increased.
So how long does it usually all take?
You know, it depends on each case. So what will typically happen is we'll do a full evaluation. We'll look at your images. We'll go over past histories, and we'll develop a treatment plan. With some of these chronic spinal cases, we'll start to see it work very soon. But there can be some general averages. Often it can take several weeks. Sometimes it can take between 15 and even 20 visits to really stabilize a patient that's hurt. But we do it according to your needs and the goals that we've established. Many people are coming to us because they can't stand, or they can't walk, or they can't sit. Those are obviously some of our goals we're trying to get done, but we're trying to really customize it for what you need.
And do you take insurance?
You know, we do participate with most of the major insurance policies, and Ali and Brittany and the staff, that we can always look into your insurance if you're concerned before you get here.
All right, let's take a look around your office.
Yeah, we just like to show you around a little bit so you know what we're all about. And then what we've decided to do is do a educational video on each of the procedures that we do, so you can evaluate and you can see what really is happening inside a high-tech physical medicine center. So if you could really follow me around, there are many different types of decompression that we're doing. This one is in a face-up decompression called the DRX. As we kind of scan through here, this is a high-tech stabilization rehab machine that we use to strengthen and stabilize this neuromuscular re-education. This device over here, they call this the ATM2, or active therapeutic motion. It's used to help decrease the muscle tone and treat movement disorders. Once you stabilize this and then you put them through the proper movements, we can see fairly dynamic and quick changes in the ability of that structure to move. Over here is a cervical decompression unit. You're treating disc herniations of the cervical spine. And if you come through this area, this is called the Alter G. This is a pretty neat device. It's an anti-gravity treadmill. And when the doctor's trying to get the patient up and moving, or if they have stenosis and they can't walk, if they're trying to rehabilitate after knee surgery or hip or ankle, trying to get moving when in a painless manner, this is very helpful. We have 3 different electric stim units, or neuromuscular re-education, where we try to stimulate that nerve or decrease the muscle activity. In the back, we have a laser room specifically there, and then we have another laser in the back. The neat part about these lasers, these are class 4 lasers. So when you classify lasers, you're talking about the intensity of, or the energy coming out of a laser. This is a stimulatory laser, so it's not a cutting laser. These lasers can penetrate quite deep into the tissue. When you're talking about then a wattage, this is a 30-watt class 4, which is actually one of the highest lasers that is ever utilized for humans. We need this type of intensity so that we can penetrate deep to where that's into deep spinal conditions. Again, lasers feel good. In the case of this room, We utilize a table here that's a prone or a face-down decompression table, so we can actually distract the disc, apply the laser, apply electric stim, and really get all of these therapies in there to enliven the healing response on these disc problems. So we're going to go ahead and we're going to make a video on each procedure. But if you have any questions, we're at 512-219-8999. We're happy to do consultations, either over the phone or in the office, and let us know if you have any questions. Thanks.